Why did research studies face ethical problems historically? Imagine a time when scientists could do experiments without telling people what they were doing or asking for permission. That was often the case in the past. Early research studies sometimes caused harm because there were no clear rules to protect participants. Researchers might have tested new medicines or procedures on people without explaining the risks or even their identities. For example, in the Tuskegee syphilis study, African American men with syphilis were not told about their disease. They were not given the treatment that could have helped them, even after penicillin was discovered. This study went on 4 decades, causing suffering and death, all without the men's knowledge or consent. Such practices created a lot of mistrust in medical research, especially among vulnerable groups. Other times, researchers used prisoners, children, or marginalized groups for experiments that involved deception or harm. They often did not ask for permission or did not tell the truth about what was happening. Some studies were based on false ideas or racial bias, which made things worse. Without rules, researchers could do almost anything, even if it was unfair or unsafe. They did not have independent review boards to check if the studies were okay. Risks were often ignored or not balanced against possible benefits. Participants' rights and safety were not always considered. These problems led to the creation of new guidelines and laws to protect people. The idea of informed consent was introduced, meaning participants had to be told what the study involved and agree to join. Independent review boards started to evaluate research plans before they began. Ethical principles like respecting people, doing good, and treating everyone fairly became the foundation of research rules. Laws like the United States National Research Act in 1974 set standards for protecting human subjects. Knowing this history helps patients understand why current clinical trials have strict rules. These safeguards make sure that research is done honestly and respectfully. Patients are given clear information about what the study involves, including risks and benefits. They can decide if they want to participate, knowing their rights are protected. So, the ethical problems of the past reminded us why it is so important to treat research participants with care and respect today.